Okay, this is the Healthier Troops in a Snap Scouting Nutrition and Activity program. This set of slides is the lead-in to our program. And why do we care about nutrition and physical activity? One of the big reasons we care about nutrition and physical activity is the current epidemic of childhood obesity, where we've seen about a threefold increase over the past 40 years, such that now about 1 in 3 children and adolescents are overweight or obese. Those numbers are similar for both boys and girls, and here we're talking about overweight above the 85th percentile and obesity above the 95th percentile relative weight for age and gender adjusted for height. Here are the prevalence data. We've seen increases across all of these age groups, and now we're about 12.4% obese in the toddler preschool population, about 17% in the children and adolescent population. It used to be the case that we weren't as concerned about childhood obesity, and we believed that there was a strong chance that they would grow out of it and there wouldn't be any negative health outcomes, but now we know differently, because things such as cardiovascular disease, diabetes, sleep apnea, asthma, some of the social issues such as decreased self-esteem and social stigma and anxiety are now linked with childhood obesity. Girl Scouts are among the population affected by obesity, and the Girl Scout organization recognizes and addresses these problems. There's a study that I would encourage you to check out from Schoenberg in 2006 called The New Normal. It's what girls say about healthy living. This was done with about 2,000 girls and also boys and mothers included in the data. The study was done with questionnaires but also focus groups, and they involved questions about obesity prevalence, health risks, and other health issues. The number one finding from this study was that girls really aspire to be normal healthy, that they want to be healthy but not in such a way that they stand out from their peers. They want to work towards a good diet and exercise habits, but not in such a way that they are different from their friends and others. Also, we know that emotional health is central here, that self-esteem and body image are largely important for the health of a child and adolescent as well. And girls' diets and exercise have to factor in those needs for self-esteem and body image. There's a tension in this group between health awareness and behavior, that they may or may not know the health behaviors that they need to do, but a lot of them are not currently practicing those. So we need to close that gap between what they know to do and what they are doing. One of the ways that we could do that is by reaching mothers and showing the mothers how to be good role models for their daughters. Here are some data on a little bit of a discrepancy between those who are in a one weight category and see themselves as a different weight. The important thing is to focus on healthy behaviors, and that healthy behaviors as well as healthy body image and self-esteem, and not so much on the weight status itself. Some of those health behaviors include television, which has been linked with the poor diet and lack of physical activity. 89% of girls report that their mothers make positive comments about how they look, and we'd like to see that increase to 100%. And daughters of overweight mothers were considerably less likely to mention their mothers as positive role models for healthy living, and we would like to see that changed as well. The recommendations from the study is to make health important to all, to emphasize physical activity, demonstrate positive outcomes that result from healthy behaviors, make good health an attainable goal, and to target adult role models, especially the mothers. We know that the things that are done in adolescence really set the stage for adulthood, so we need to make changes now before it's too late. So what can we do? Well, we can establish good health behaviors now, and these include fruit and vegetable consumption, limiting sugar-sweetened beverages, and encouraging physical activity, because lots of girls are not meeting guidelines for physical activity and diet as well. Need to limit television and promote family meals. And here's the unique program, Healthier Troops in a Snap, which is set up to provide a curriculum designed to promote all those healthful behaviors in Girl Scouts. It's fun and it's easy to implement. Here's how you can access those materials.